Hello everybody, my name is Dr. Nikita Chattai and I'm the course director for BIE Grant 2024 More Than a Mini Fellowship. Today on 14th August, we are inaugurating our 8th boot camp here in Singapore at Holiday Inn. And this is a very comprehensive program that we have carved with 2 days of mammography boot camp. In this boot camp, we will showcase about 250 cases. Most of them will have artificial intelligence as well. There will be also exposure to the participants for DBT and contrast mammogram.
This is a very good course because it allows you to go through many sets of cases, normals and abnormals, and all under the guidance of experienced breast faculty such as Dr. Nikita. It is a very intense course, but the good thing is that you will get to see many cases in a very short time, and maybe more than one will ever get to see in a few years.
There is a lot of things in a very short span of time. I have gone through the entire program before joining, and they were saying there are like hundreds of cases of digital mammography and MRI, and there is a hands-on experience of interventions as well, which definitely we are going through, and we literally have a lot of definitely experience, hands-on practice on hundreds of cases of digital mammography. I think more than 800 cases of digital mammography, and today we went through hundreds of like CEM and DBT cases with a faculty all around the world, a very diverse faculty, and especially I must say Dr. Nikita Chattai, who is our course director, like she was amazing.
I am Dr. Jerome Fernandez, a radiologist from the Philippines. The venue was nice, food was great, and then the program itself, it's very comprehensive.
The multimodalities make life easy, especially with the AI and the contrast enhanced, even if it's not exist in some hospitals. And even if you're not using it, I got an idea of having these tools in the hospital in the future.
MRI boot camp, where there will be more than 100 worked up MRI cases with a lot of different types of cases taken out from the clinical practice.
But it has totally changed the perception because it's like a friend to us. You can diagnose cancers early easily, and it is helpful for the patients for the early cancer treatment and all. So even MRI also, I feel more confident in reporting MRI cases now.
First of all, I would like to thank the faculty. They had taken so many painstaking efforts to make us all comfortable, and the program was from start to finish was done so beautifully that we all enjoyed. Not even 1 minute was wasted. Everything was so perfectly and impeccably organized. So hats off to the entire team of BIEDX, and we'd love to use this information in our practice, and we encourage all the radiologists everywhere to globally to attend this conference next year.
Yeah, definitely. So there's a spectrum of from easy to more challenging cases. Will definitely help in future in my work. And yeah, I think the faculty has thoroughly thought through the material before presenting to the attendees, and that's what makes the course quite unique compared to others.
Well, for the past 2 years that I've been a member of BIE, I think not just for this training, I think as a breast reader, this program has really welcomed us to a new community, and then to help one another in our practice, especially in reading breast pathologies. So I encourage them to join the training, and of course to experience everything that we have experienced, also the excellence and the compassion staff, especially Dr. Nikita. So I encourage you all to join us.
Yeah, I think I would definitely recommend whether you're a junior or even a person who's already in the daily practice.
It's going to be a very extensive workshop where the participants will get exposure and also time and opportunity to practice stereotactic ultrasound, core biopsies, vacuum biopsy, as well as MR biopsy, as well as the latest advancement on wire-free localization. So it's a very comprehensive program, and hence the name Mini Fellowship.
It's a very well designed program and very well implemented also, like on the team, from the organizers, from the speakers, everything, even the food, everything is taken care very well.
I'm absolutely loving the course so far. My reason for coming was I needed a one-stop shop, easygoing, and all questions could be asked, and it was at a really great value price. So everything BIE meets in those respects. So I would really encourage everyone to try out BIE, not just from Asian countries, but also from Western countries, because you'll find it incredibly good value for money.
Yes, I would recommend this even to other, not just breast radiologists, but also other breast surgeons learn from.
10, 11, 12. I rate it 11 out of 10. Probably 9.5.
Okay then. Okay, 10. 12.
This is a 10.
Oh, definitely 11.
I will give it 10.
Oh, I would give a 15 over 10.
10 out of 10.